Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the award-winning Hospital Finance Podcast. Kaufman Hall recently released their National Hospital Flash Report for April 2022. Unfortunately, the report shows that hospitals across the country are still struggling financially. Today, I'm joined by Erik Swanson of Kaufman Hall to discuss the result of this latest report. Erik, welcome back to the show.
Thanks for having me again, Michael. It's great to be here.
So, Erik, what would you say are some of the top takeaways from your April report?
Yes, well, thank you. And I think you stated the context appropriately, but let me restate it and then talk about a few of the findings that we saw. So as you mentioned, from April of 2020, unfortunately, it was not a particularly good month. In fact, it was quite challenging. What we saw was a pullback in volumes and revenues alongside some continued expense pressures, leading to the fourth month this year with negative margins. And within that, underneath that context, what we see here is that the emergency department is no longer the hospital's front door. So many patients appear to be seeking care outside the hospital and choosing a variety of different methods in which they receive that care. We also see that the patients coming into the hospital are coming in sicker, likely due to earlier delays in care, and perhaps also due to the rise in COVID cases that we began to see in April as well. Those expense pressures remain high and have been since the beginning of this year and even the end of last year. And again, some of this is also driven by the utilization of contract labor, driving up some of those labor expenses. And then finally, important to note as a key takeaway here is that given that this is the fourth month of negative margins, it's really beginning to take a toll, a financial toll on hospitals and health systems, leading to some outcomes where they're having to potentially delay strategic plans and capital investments and even begin to consider the type of care that is being delivered, and certainly foreshadows a challenging remainder of this year.
So let's dig into some of the specifics around what you just said, Erik. How would you say the hospital margins fared in April?
You know, unfortunately, quite poorly. So the median operating margin in April was minus 2.85%, and cumulatively through the first 4 months of the year was minus 3.09%. And, you know, even in good years, margins are very thin for hospitals. But given that we've now had 4 months with hospital margins being in the negative, it is an incredibly challenging situation. I think it's also worth noting that what adds to this challenge is that there is no additional care stimulus funding to help buoy these results, as we've seen in years past, leading to what we saw in this most recent report with those negative margins being down nearly 50% or greater relative to last year.
And everyone's been hopeful that volumes would begin to rebound in 2022. Did you find that to be the case?
You know, in general, that has not been the case, but we can mention a few of the bright spots. So to begin with, in general, volumes still remain relatively soft. So discharges, the inpatient discharges, are down nearly 4.5% from last year, and patient days down by about 1.8%. We have seen some ebbs and flows in these volumes, and in particular, March, there was a slight increase. However, they remain down relative to pre-pandemic levels generally. It is worth noting, though, that the average length of stay, so of those patients that are coming into the hospital, as I alluded to earlier, are sicker and are thus staying longer. So the patient days is not as deeply depressed as the discharges, but that speaks to the types of patients being slightly sicker. ED visits are slightly up from where they were last year, but again, to set the context here, the emergency department relative to pre-pandemic levels is still quite depressed. And again, this highlights patients seeking that care through their primary care physicians, urgent care centers, and various telemedicine offerings. The one thing I will mention from volumes is that what we are seeing here and seeing the first few months of this year is that the outpatient volumes the outpatient revenues are slightly up year over year as we see a bit more activity occurring on the outpatient side. But as mentioned again, the inpatient volumes still tend to be quite anemic.
Okay, so we covered margins and we talked about volumes. So when we add it all up, what did revenue and expenses look like for the month?
Yeah, both of these followed similarly to what we're seeing with the volume. So it's important to note here that as we had that slight pullback in volume on a month-over-month basis, revenues consistently fell across the board as well. So when compared with last year, inpatient revenue is down about 1.3%. But as I mentioned, that outpatient revenue is actually up about 3.5%, highlighting that shift away from inpatient care. The revenues on a volume-adjusted basis, again, are a bit mixed. And again, this owes to the fact of an increased length of stay type patient. So on a per discharge basis, revenues are up. But when adjusting for how long those patients are staying, actually down minus 2.2% from last year. So in general, revenues tend to be soft relative to what we're seeing. And unfortunately, while those revenues are soft, expenses have continued to remain quite elevated. So total expense is up about 8.3% from last year. And this is primarily driven by the labor expense increases, which are up by about 11% on a year-over-year basis, or 15% on a volume-adjusted basis. This is mostly due, as I alluded to earlier, to the increased labor pressures, both from the rate increases, as we've seen some increased competition on the rate side in the market, as well as the utilization of contract and agency labor, which is also a very expensive and premium labor component. Non-labor expenses also remain elevated, about 4.5% last year. And in this most recent month, much of the non-labor expense increase is owing to an increase in both supply and purchase service type expenses. And so many organizations, again, are reevaluating their supply chains to think about how they can potentially influence that. I should mention that within the report, what you'll see is that drug expenses dropped this month slightly, again, as those volumes pulled back. However, those drug expenses are still elevated from pre-pandemic levels, as both the cost of the drugs has increased slightly, as well as the utilization of more expensive type drugs and specialty pharmaceuticals. So in general, unfortunately, revenues remain soft and expenses remain quite elevated, which ultimately leads to that conclusion with the owing to the decreased margins that we're seeing.
Well, it certainly continues to be a challenging time in healthcare. Erik, if someone wanted to get a copy of the latest report, where can they go?
Yeah, absolutely. So they can access the report at kaufmanhall.com under the Data Analysis and Tools tab. And individuals can go there to subscribe to any future issues, as well as access the monthly data pack that supports the report as well.
Erik, thanks so much for joining us on the podcast again today.
Thanks so much for having me, Michael.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.